Do you have an L4, L5 disc bulge or disc herniation? Or do you have an L5, S1 disc bulge or herniation? In this video, I'm going to show you how to get out of pain if you have an L4, L5 disc video. Also, I'm going to show you how to personalize the exercises to get better faster. I'm Dr. Gregory Kramer, certified corrective care chiropractor. I've been helping people live stronger, longer for over 30 years. So what I'm going to do today is we're going to show you what a herniation is, and I'm going to show you how to categorize yourself in so that you can get the best in terms of exercise, sleep position, and what do you do. Disc herniations are horrible. Not only a lot of back pain, but buttocks pain, leg pain. They can cause weakness. They can radiate into your groin, into your testicles if you're a male. Now, here's a caveat though. Now, there's a few warning signs that you need immediate emergency attention. So if you've lost control of your bowel or bladder, you need to go to the ER ASAP. If you've drank a lot of fluids, but yet you have not urinated, you need to go to the ER. Other than that, most of you have some time on your side to heal naturally. And I want to tell you also that not only am I as a doctor that have treated over a couple 100,000 patients over the last 30 years, I'm also a patient. I've had a horrible L4, L5 disc herniation. I know what it's like. If I can get over it, so can you. All right, so first look at it. We've cleared ourselves of the red flags. Our bowel and bladder is fine. We're going to the bathroom. We're not getting severe weakness. Now, you might be weak. You might have a little bit of weakness. A little bit of weakness, you can still walk, but your foot is not completely dropped. We have some time. Now, if we look over here on the MRI, this is the lumbar spine. This is the disc, lumbar spine. Okay? This is a large herniation at L4. This is a smaller herniation at L5. This is your sacrum right here. So what is a herniation? A herniation is a tear in the disc. This is the vertebrae, disc, vertebrae. So I want you to look at this red line here. In this model, the red line indicates a tear. And that's very painful in the lower back. Okay, you can feel it on the right side and the left side. Now here is a nerve, and these nerves go to the right side, and then this side would go to the left. These nerves control how you feel, they control your muscle strength, and control your organs. Now, typically we injure the spine with either one harsh injury. We lifted something, we're in a car accident, so one very traumatic event. Or we've had multiple micro traumas. You bend and twist for the last 20 years, either your work or your golf, tennis, martial arts. So look at the red line, that's an annular tear. Eventually it can get so bad that the inside of the disc, called the nucleus, can start to bulge out. Can you see that? That's a herniation. Now notice it's when we flex, this is the back of the spine, this is the front. So if we flex forward, notice how it bulges out. You can see it back in. I'll show you again, right there. Look with my finger, look at the red mark. That's a herniated disc. And that can cause horrible buttocks pain, horrible leg pain, horrible back pain. Now notice if I just press out on the back side, it doesn't come out as much. And notice when we press in the front, so when we flex the vertebrae, so usually a disc is herniated by flexion and rotation. So flexion and rotation injures the disc, and that's what a herniation is. And then decompression, see if you can see that, it sucks the material back in. So if you have a herniated disc, decompression can help that. Now, today we're going to show you a concept called directional preference. So I'm going to put this down, and typically I'm going to give you an idea of what exercises are best for you. So I'm going to make a generalization. So today's video is about an acute disc problem. All right, not an old one, not a chronic one you've been dealing with, but this is acute. This is, within a couple weeks or a month, and you're still in a lot of pain, okay? So the first thing is we've cleared the red flags. Typically, if you're 50 years old or under, 50 or under, if it hurts to sit, but better when you walk, feels better when we lean back, typically extension helps you. So this motion is extension, flexion is this motion. Now remember, most disc problems are from flexion and rotation. So I showed you when I flex the spine forward, get a close-up, look at the red mark, that's an annular tear. When we flex the spine, so when the back of the spine separates, see how that's separating? The disc can herniate. So, in many people, particularly 50 years old or younger, hurts to sit, better when you walk, feels better if I repeatedly lean back. And also typically it hurts in the first third range of motion. So if it hurts as soon as I move, usually it's a good sign you got a disc. So that group of people will feel better typically with extension exercises. It's that simple. So we use the term directional preference. Basically, what feels good? Does it feel better to bend forward? Does it feel better to lean back? You do what feels the best. So again, we're going to talk about extension exercises, or if it hurts to sit, better when you walk. So the first thing you can do is you can lie face down. Now I'm going to take this model, I'll put it here. So if it feels good to lie face down, you can first lie on with your head down. The second, test if you can lie with two hands, or just prop yourself up. This would be what we call a prop-up position, or Mackenzie exercise. If this feels good, see if a push-up, I keep my belly down, and I push my chest up as far as comfortable. And I would repeat this. I would hold, and if this feels good, I would repeat it several times a day. In fact, if it hurts you, we don't do it. So remember, anything that causes pain, we stop. Anything that causes radiating pain, that means pain going from the center of your spine down your legs. So radiating pain is not a good sign. We want to see centralization of pain. Centralization of pain means if you have leg pain and you do an exercise, now the leg feels better. Now the pain centralizes to the center. That's a good sign. So again, if extension feels good, it's better when you walk, worse when you sit. Usually you're 50 years old or younger. We test to see if this extension exercise, what they call Mackenzie, we test with the easiest version by lying face down. Then we prop up with two fists. Then we go to our forearms. If that feels good, we test. We can do a push-up. It's called an extension push-up. And I would say if it feels good, the more the merrier. You could probably do about 10 reps, hold each one about 10 seconds, and you could probably do that every hour if you're in agony. Remember, we only do it if it feels good. Now, some people, it feels so good, it makes their back and leg feel so much better that they can lie there and prop some pillows under their chest. So those of you that it feels good, the more time the better. And also you can put some ice on your lower back while you do it. Don't burn your skin. So you can do a Mackenzie prop up, put some ice on it. You could do it every hour. You could probably, if you're in agony and it helps you, you then put a pillow underneath your chest. Now remember, this is the directional preference, okay? So again, extension feels good, walking feels good, sitting is the worst, flexing forward is the worst. Then that's a good sign that you're a candidate for extension type exercises. So we showed the prone Mackenzie. Now what if you're sitting? All right. Now again, this is for an acute disc, like you're in bad shape. Well, if you sit up and you arch your back, you can push on your knees and really arch. Okay? You can test that. Now remember, if you're acute, you might not be able to handle that. Okay? You can stand on your side, lock your knees, put your hands behind, right on your hips, and lean back. Again, if that feels good to you, then the more the better. Okay, so this is for an acute injury. You're going to do ice, you're going to walk a little bit, and you're going to try to get some relief. You're going to sleep in the position that's comfortable. If it feels great to sleep face down, then do it. If it's not comfortable, most of you will feel better probably lying on your side with a pillow between your knees. Now this is how you lie down. Now remember, when we sit, sitting is really hard on the disc. We really want to minimize sitting as much as possible. But if we do sit, we got to sit with a good arch. Okay? And then how do we lie down? We tighten our stomach and we lie like this. Okay? And then we roll like a log either on our back or on our stomach. Tighten our stomach, let our knees come forward, elbow the couch or bed, and get up. So that's the basis. Okay, so we're looking at a directional preference where extension or leaning back helps you, flexion hurts you, sitting hurts you, but walking is good. So to summarize this, go to the ER if it's an emergency. That means you got extreme foot drop, you're losing control of your bowel or bladder. If you don't have the emergency signs, which most people don't, then you got some time on your hand. You want to control inflammation with a lot of ice. If you need more than that, talk to your physician. And again, I am not only a doctor that has seen hundreds of thousands of patients, I'm also a patient myself. I've lived life, I train in sports. I've had 2 huge herniations in my spine, and I got over it without epidurals and without surgery. So I want you to know that there's hope for you guys. In fact, I want you to think I want to sell hopium. And I'm really big on that, okay? Hopium is a non-toxic drug. I want you to have hope. The body has a tremendous chance to heal and repair. Exclude, now sometimes there is a time for surgery, but exclude the rare times that happens. Give yourself some time, ice it up, find a comfortable position, and whatever position is comfortable, whatever position minimizes back and leg pain, that's the position for you. So again, this is the extension-based exercises for people that hurt when they sit, better when they're walking, and also typically if you're 50 years old or younger, that's usually the type of exercise that will help you. On the next visit, I'll go over, well, what if it hurts when I walk and better when I sit, and I'll address that. I'm Dr. Gregory Kramer, Livonia Chiropractor, helping people live stronger, longer for over the last 30 years. If you like this information we're talking about regarding an L4, L5 disc herniation, disc bulge, or an L5, S1 disc bulge or disc herniation, please like and share this. If you got questions, send me the questions. I'm going to do my best to try to address them. I'll see you guys on the next video.